I've been in the nursing field for a little over 10 years. I've been working in the hospital setting for the past several years of that 10, and in the past 2 years, I've been working in a dedicated COVID unit. My very first instinct was that, well, it's going to be like a really bad flu and we just have to be tougher than it. And then the cases started really coming in, and I started to think, well, maybe it is a little more serious than just the flu. And I think probably by March of 2020, when it first hit in my hospital, we really saw an explosion of cases. And it kind of waned a little bit, and then by October, November of 2020, every bed in my hospital was a COVID patient. And part of that was because they had to be COVID patients. We would reserve beds specifically for COVID positive patients. So that meant that the heart attack patient in the emergency room, if they weren't COVID positive, they weren't getting the bed because those beds were reserved. So at that point I started to look at it like, okay, something's not quite right. Then I started to watch the numbers on KDHE, and they weren't matching up with what I was seeing in the hospital. It wasn't matching up to, the exploding numbers on the website versus what we're seeing in the hospital. And so I started to read the fine print, and it talked about presumptive positive cases were included now in positive cases. And so I looked at their definition of presumptive positive. And that would be, working in a COVID unit, anybody that I came into contact with would be considered presumptive positive because they were in close proximity to me. So they were automatically counted as positives. And so I'm watching these numbers explode, and that's when I started to think, okay, something is really wrong here. The numbers are being manipulated. And then we had another huge burst of cases come through that were very sick. But it's still, the numbers just weren't matching up. I continued to kind of follow the trends, and I started to realize that the testing that we were using, it was almost impossible to test negative. People that were coming in, that they were like, I came in for a urinary tract infection. I didn't even know I had COVID because there's no COVID symptoms. They're not coughing, they're not short of breath, their oxygen level's fine, there's no fever, they've had no known exposure, but suddenly they're being held in the COVID unit and being treated for a UTI secondary to COVID-19. And for the period of November 2020 to at least April of 21, there may have been a handful of patients on my unit that were not considered COVID positive. And it didn't make sense to me. It still doesn't make sense to me. Because if you think about it, I am one person. If I test positive, for example, everybody in my household is considered positive automatically. And every single patient that tested positive, all of their family members were considered presumptive positive. It doesn't matter if they've been tested. It doesn't matter if they are symptomatic. They're automatically presumptive positive. So those numbers went in as positive cases, although it's very clear on KDHE that it's not confirmed positive, but we're still going to count it as positive. And that's very deceptive. Since the vaccines came out, now it is almost impossible to test positive for COVID.